Good afternoon, friends. It is Thursday Night Live. It's an honor to be back in your home, and I thank you for letting me into your home to discuss important topics as we usually do on Thursday nights on this platform, Broken But Not Wasted. Well, today we have a very, very important topic. It is women and postpartum depression. Many of us, if not most of us, know the joy of having a newly born baby in the home. Well, with that joy, also, there is a side that is not always talked about. Is when the new mother experience what they call the baby blues, or the clinical term postpartum depression. So when the woman, after giving birth, experiences changes in the body, experiences weight gain, the belly's still big, the breasts are enlarged, they go through hot flashes at night, there's sleepless nights with the baby, staying inside for weeks and not be able to go anywhere, they're on lockdown with the baby, and so on and so forth. They do tend to experience postpartum depression. With me tonight on this platform are Dr. Joanne Compa-Baril. She's no visitor to this platform. This is not her first time. Matter of fact, last year, almost a year ago, she was on this platform for Breast Cancer Awareness Month in October of 2019. So she did a wonderful, wonderful job. So we thought we would bring her on because she is an MD. She's an OBGYN. Also on the platform is a young woman, Miss Sofi Mino, that has gone through postpartum depression. Statistically, it is said that over 900,000 women annually suffer from postpartum depression in the United States alone. So globally, you're looking at tens, if not hundreds of millions of women suffering from this illness as it is. So Dr. Baril, I'm going to bring Dr. Baril on. Dr. Baril, bien le bonsoir. Bien le bonsoir et bienvenue encore sur ce plateforme Broken But Not Wasted. Cela fait peut-être un an que l'on s'était vu. Donc maintenant, on va parler d'un autre sujet, postpartum depression. As we know, Dr. Baril, the first appointment that a woman who has just given birth has is with their OBGYN. So please, Dr. Baril, when women come to you for their 6-week postpartum visit, how do you determine if that woman displays signs of postpartum depression?
Alors Sarah, je vais te retourner le bonsoir. C'est avec plaisir que je te rejoins ce soir sur ton network.
Yes.
Et c'est un plaisir pour moi de te rejoindre pour ce sujet particulièrement. Et je te félicite encore pour ton initiative. Et je vais tout de suite changer mon langage pour commencer directement dans le sujet. Donc, you just asked me what are the tools that we may have as an OBGYN to determine if a patient may or may not have postpartum depression. Okay, so as you said, after 6 weeks, there is what we call the postpartum visit. And during that time, we try to have what we call there is a screening tool, there is a questionnaire that we use. And I would like to warn maybe other physicians listening or nurses listening and patients themselves, that tool is very useful, very helpful. However, I would suggest that we use our common sense more, okay? So that's where maybe as a woman, we can relate maybe better to another woman going through that period in their life. Okay, so it is a very difficult time for women, and I know that everybody expects pregnancy, delivery to bring joy, but it doesn't happen all the time. And c'est pour ça que, alors je vais prendre la langue maternelle qu'on a.
Bien sûr, bien sûr. Vas-y, docteur.
Parce que, alors, je voulais saluer l'auditoire aussi parce que m'a dit tout le monde bonsoir. Cap Kandé. OK, il est très important. Sujet ça vraiment important. Et je remercie Sarah que il vient avec sujet ça. Moi, j'étais très content pour me dire oui, m'a venu dans et soirée hein, live. Ça m'a fait nous comprendre, c'est pas un bagage pour nous peut parler de lui. OK? Post-partum dépression, yo sous-estimé et yo pas même des fois yo pas même reconnaître que on a passé par un moment ça. Son condition qui est vraiment commune, j'en dis à les rencontrer en pile, gen moun qui pas même reconnaître que yo gagné. Ou parler de postpartum blues. Postpartum blues là, c'est une petite forme très minime de postpartum dépression. Li même li rive 1 à 2 jours après que mon fin accouché, mon a commencé à sentir li pas dans lui-même, li sentit pas bien, li sentit pas content. Au lieu pour ta enjoy moment ça, pour commencer bon appétit li rend li compte que li toujours fatigué, l'envie crier sans raison. Jusque là, postpartum blues là, d'après tout ça yo dit dans la littérature médicale là, il pas supposé durer 1 à 2 semaines. Et il est presque tout à fait normal parce que par contre sous capable faire l'approchement l'homme enceinte a 2 hormones male female hormones œstrogène progestérone yo monte mais autre pour qui ça c'est parce que le corps humain est très intelligent hormones ça yo présence yo dans niveau que yo monte pendant grossesse là li permettre un paquet d'ajustements fait dans le corps futur maman. Un paquet d'ajustements qui est important, qui est nécessaire tout autour moment grossesse là, pendant tout parcours grossesse là et particulièrement au moment de l'accouchement. Donc hormones ça yo malheureusement yo pas arrêté dans le niveau que yo téye pendant grossesse 9 mois. Au moment de l'accouchement, yo pral drop, yo pral descendre, donc fluctuation qui fait. Donc même gens, jeunes petits monde qui dans reproductive âge, yo gen tendance gagner ça yo les PMS, yo gal gen période, yo gal gen règle, yo commence vinn moody, yo vinn anxieuse, yo un petit peu depressed, yo ça, yo pas comme ça yo gagner, c'est même phénomène passé, mais à un niveau beaucoup plus intense. OK? Même gens tout mesdames qui ménopausé, leur hormone ça yo pral baisser l'ensemble dans corps yo pral passer une période très difficile périménopause ménopause côté que vraiment yo pas même compte qui est yo y encore. OK, donc c'est même hormone ça yo qui responsable de postpartum blues, postpartum dépression et puis m'a aller plus loin dans l'autre forme que les postpartum psychosis. OK, psychosis ça veut dire que moun nan presque vin fou et me connaît une expression en Haïti côté que yo dit que l'être monté moun. OK, c'est pas un menti ça qui arrivé mais c'est pas l'être qui monté, c'est hormone yo qui upside down, c'est hormone yo.
So Dr. Barrel, you were saying that there is a big difference. We have some viewers. Yes, okay. There is a big difference between the baby blues or the postpartum blues, which lasts maybe a couple of days, versus the true condition of postpartum depression, which you have paralleled with menopause or premenopausal state, where the hormones are raging. And you've also said that during the pregnancy, both the male and the female hormones are very high. Is that what you said?
No, those two hormones are primarily female hormones.
The female
They,
hormones
yeah,
pretty
they
high.
play a very important role in the menstrual cycle, and also during pregnancy, they are very important.
Okay.
Okay,
So, but then at birth or after birth, they drop.
they
Would
drop.
you
Exactly,
explain why the women get so emotional?
exactly.
Okay, I myself, I've given birth 3 times, and I did go through also, although it didn't last. You go through that down period, like you said, when you're crying, you don't know what's wrong, and so on and so forth. So, like I said, a lot of women suffer from it, and you've also confirmed that many women don't even know what it is, and they do suffer from it, and you think that it is something that maybe it's only you feel lonely, you feel hopeless, you feel helpless, you feel like there is no hope, no tomorrow, yet you should enjoy that baby. It's the time to enjoy the baby. I'll give you an example. With my firstborn, I remember sitting like this one time. I just sat and I was looking in the far horizon, thinking like, I feel like running away and never come back. Does that sound familiar?
It is very familiar.
Yeah.
You're not the only one.
Yes.
And this is why during the prenatal care, it is very important for any new mother, young pregnant woman, or even if it's your third baby, it can happen again and again. Okay, I think it's a good idea for the OBGYN doctors to introduce this topic,
Right.
even during the prenatal care. It is
Yes.
important because sometimes patients get really panicked easily because it is scary. It is scary because you don't know what's going on with you.
Yes.
You think you are
So,
going crazy. You think you are going insane, and somebody has to explain to you it will happen. And as I told you, as long as it's the blues, the postpartum blues only, the baby blues, that condition will last maybe 1 or 2 weeks, will go away on its own with no intervention. I would say at this moment, what is needed is maybe reassurance. It's also the family support, okay? And we should encourage the patient to sleep as much as they can,
if
okay?
you can, okay.
Exactly.
So we're going to bring our guest, that young woman who has gone through this, and she's going to share, she will be sharing her experience. Again, with us this afternoon, we have Sophia Mino. She was born in Guayaquil, Ecuador, and at age on her 20th birthday, she moved to Cleveland. Let me bring her on screen. Thank
Hi.
you. Hi. So this is Sophie. And when she gave birth, Sophie had her first son, her firstborn son, on April 24, 2019, Lucas Emmanuel. She brought him into the world. Well, her and her husband, they could not have been Jean Paul Zabala. They could not have been happier. Like I said, new birth, new babies bring a lot of joy, a
Yes.
lot of happiness. Getting to know what that was the fruit of their room, okay, of their first strength. However, a month after, she developed a severe type of depression. The Zabalas experienced a lot of ups and downs, diving into a river of uncertainty while exploring different options to find healing, individually and as a family. Now, the Zabalas are restoring their home day by day. They are no longer, they used to work as youth pastors because they have a passion for the youth to share their faith with the youth and to build them. Now, they do no longer work as youth pastors, but they still care and encourage the youth. Sophia started to share her journey in social media through her movement, Mommy Can and Mommy Will. Since then, she has invested her time to be open about her depression and anxiety in a world that tends to deny or minimize that condition.
Yeah.
Sophia, welcome to Thursday Night Live. Welcome to Broken But Not Wasted. What a great story you have to share. We all have a story, we all have a voice, but yours is different because not too many people, not too many women speak about that. Sophia, please, I thank you for coming on,
Thank
and
you.
please tell us, share with the viewers your story.
Yes, it's so wonderful to be here. I would say it's definitely a blessing. It's an answered prayer to be here and to be able to share what started off as the worst experience ever in my life. Um, since I was younger, I always had, some issues with, I would say, not much my attitude, but my ups and downs, my self-esteem, how I would deal with issues, how I would have sometimes meltdowns. But I was a 16-year-old that should not have been acting that way. Later on, when I met my now husband, we thought it was normal, just not mature enough. Later on, when we got married, I did have a depressive time. Never went to psychologist because mostly in Hispanic cultures, I know we also talked about Caribbean cultures, we don't accept psychological help as well as other cultures because we feel we're ashamed of it. So I did not get help. Instead, I found my refuge in God, which is a wonderful thing too. And I was able to find my healing through God. So I feel very blessed that happened to me. But later on, through my pregnancy, it was amazing. I was so happy. Hormones were definitely a good thing for me. But later on, when my baby was born, a month after, instead of experiencing baby blues, I, I skipped baby blues. I was more like just feeling a little different. But a month later, I was diagnosed with postpartum depression. Every night, my baby would wake up several times. I would get frustrated. I think I had way too many expectations of what having a newborn was going to be. I thought, I thought he was going to sleep. They tell you babies sleep during the day and they wake up during the night. So I kind of was expecting that, except that my son, he wouldn't even sleep during the day. He would take 15-minute naps or 20-minute naps tops, and then that was it. So I wouldn't have time to rest. I wouldn't have time to be myself. I wouldn't have time to spend time with my husband and feel not only a mom but a woman and a wife. So it started getting worse when there were moments that I would tell myself, maybe if I just, and I'm sorry if this word sounds hard, but it is the truth. But I would say maybe if I just die for a little bit, if I just disappear for a little bit, things will get better. There were moments where I was holding my baby to make him sleep, and I wouldn't even be able to hold him for more than 10 minutes. I wouldn't be able to wait more than 10 minutes of him crying. I would immediately freak out and call my mom. My mom lives in Ecuador, but she came to stay with us for 4 months. And I would call her crying to a room, or I would just tell my husband, get him, because I just can't. And the first thing is finding help. It was hard. It was hard to accept that a youth pastor, that a child chosen by the Lord would experience such a deep pain. Knowing the greatest love from God, I felt hate. I felt disgusting. I felt I was not good enough for this baby, for Lucas, and I wanted to quit. I wanted to quit. Then my husband was able to find people that were willing to help me. We started seeking counseling, and we realized it was not just postpartum depression, but it had developed into severe depression and anxiety. Um, and thankfully, I did not have that many suicidal thoughts, to that would put my life or my baby's life at risk. But there were moments that were really complicated, and I got to a point where my therapist recommended to either take medication or, sadly, be Baker active. Uh, I did not like those news. I did not take it very well, and I accepted medication. The reason why I did not want to accept medication was because I was scared. And because my therapist told me that I had to quit breastfeeding. And actually, breastfeeding was one of the main triggers for my depression because it was hard. My baby had a tongue tie that we had to clip later on. He wouldn't latch well. I had a milk overflow. So it was scary. And I didn't want to stop breastfeeding. And I would cry to God and be like, Lord, why would you take away from me something that is so beautiful? Um, so I was going to take the medication. And then I said no again until I started to research and ask around and ask other women that have gone through it. Ask them, do you take medication? And they would tell me, yes, I do, and it's okay. And I was just so amazed how these people were doing fine. And it was such a blessing. So then I found the right medication that supported breastfeeding. And I was so surprised that I was able to be myself again, that I could still breastfeed my son. There were nothing happened to my child. He's still a wonderful baby. He's 16 months and he still breastfeeds. it's crazy, but I found, I wouldn't say absolute healing, because it's a process, but I have found healing in the way. And it's so amazing to be able to see myself in the mirror and be like, Sophie, you are back. You're back to your old self,
Okay.
cheerful and happy.
Yes, and you are okay. That's great. That's wonderful. Like I said, I myself, after giving birth to three baby boys, I did go through those little bouts of
Mhm.
depression, of feeling uncertain because changes in the body. I mean, it's just like totally you some
Yeah.
days you feel like you're a wreck. You don't even know who you are. You haven't done your hair. I mean, shower. Some mornings you get up, you can't take your shower. The baby's crying. And you said something that yours did not get as far as suicidal thought. I
Mhm.
did share on one of my lives one morning, a morning of prayer, as I was doing in July with the viewers, that with my second son, I think he was about a month old, my second one. And all of a sudden, a feeling came over me out of nowhere. And I'm looking at this beautiful, peaceful child. And the thought comes to me, I mean, clear as daylight. Why don't you kill the baby and kill yourself?
Mhm.
Period. Point blank. I know I wasn't dreaming. I was not in a vision. I was awake, but I just looked at the baby, contemplating the baby's face, and it just came to me. But thank God that thought was taken away with force. I mean, violently, as quickly as it came to me. Thank God.
Yeah,
So,
Pastor Sarah. And actually, that's what my therapist would call passive suicidal thoughts, and that's what I went through too. And she would mention how she would remind me constantly how these are just thoughts, and she would tell me she would tell me it's okay, it's just a thought. Thoughts can't hurt you.
and we know the origin of these thoughts. They're not ours. We know where
Yeah,
they come from. If
yeah.
they're not coming from God, they come from the other side. So
Hmm.
God was with me that day to take away that thought.
Amen.
Dr. Burrell, we have a question for you. The audience is asking, um, does every woman go through postpartum depression? Every woman who gives birth, these women go through postpartum depression? Because you said during the prenatal care, they should be advised that yes, it's going to happen before they even give birth so they don't panic. So is it something that is to be expected for every single woman?
I think it's very, very common. And I'm going to give you about the numbers, okay? For the postpartum blues, the baby blues, which is the mild form of depression, right? About 50 to 80% of women can experience that. And
What's
for
the
the postpartum
percentage?
depression,
What is the percentage?
50 to 80%.
50, 50,
Yes.
50 to 80%. That's
And
a large
yeah.
number.
So this form is maybe what Sophia experienced at the beginning, and they told her it was okay, but if because it persisted, so after 4 weeks, we no longer call it blues. It's more serious. So at that time, we go to the next level, what she called postpartum depression. And this form of depression is about, I would say, 6 to 16% of patients can go through it.
The
And
chronic one.
because we are in the topic, we have to go to the next level, the most, I would say, dangerous and serious one, where we are talking about suicidal thoughts, homicide. A lot of bad stuff can happen. Thank God it's always only 0.1 to 0.2%. We're talking about the psychosis part. So I'm glad that Sophia underlined a lot of her symptoms. Um, it is true. I think only a woman can relate to what she just said. Not having enough sleep, I think, is it's a very important, I would say, factor. Not having the good support also. Even her husband was there, but she felt that she was no longer free of her time, and she became overwhelmed. And this is what happened when we have a new baby. We don't sleep enough, we become overwhelmed. Even we are prepared for that, but it's very easy to become overwhelmed because we no longer have that management of our time for just ourselves. It's like we are managing our time, we are managing the time that we allow to the baby, and at the same time, we have to remain a wife. So it's very stressful. It's a very stressful situation. And as you said, Sarah, other factors that can cause, that can, I would say, precipitate and that can trigger this type of issue would be also the body image. Okay,
Right,
it's not that we are vain. It's not that we are superficial, but it is true.
right.
After delivery, we are no longer the same person. Okay, as you said, some people can accept that transformation, but some people think, okay, this is the end of the world. I'm no longer myself, and they don't think people is going to accept them the way they change. Okay, so that's why I would say this topic should be listened not only by women, but also by men, by family members. Okay, because sometimes the first help that we can have is the family support, your significant other support. Okay, and I would say that it is very, I would say, important for everyone to be on the same page, and understand it's not easy. Because, as you said, Sophia, it's a big event. Being pregnant, having a person, a human being, getting formed inside of another body, it's a big time. It's a big event. So a lot of changes occur during that time. And not only physically, but I would say mentally, your mind, everything is going to change from that time you become a mother. Okay, so some people are prepared, and some people, even they get prepared, as we just said, because of the hormonal changes, they are no longer themselves. And I
Yeah.
don't want people to feel that it's a shame. It's not a shame. It happened to a lot of people, more than we thought. We have to talk about it. We have to
Yes.
just be open minded and have, our surrounding world aware of the support they should bring to us as women after delivery, because it's true, this is a real problem. And if it is, I'm glad that you accepted to take your antidepressant medication. People are scared of taking antidepressant.
Very. Yes.
Okay, and I want to just remind to everybody listening here, when the mental, the mind, the brain is no longer balanced, is off balance for chemical reason, not because we are stupid, not because we are crazy. It happened that at some point in our life, some events, some conditions, physical condition or events, external, internal, can cause chemical imbalance in our brain. And the brain that are the hormone, the neurotransmitters that are responsible to balance our mood, our emotions can be off. It doesn't mean that we are crazy. They call it crazy, but it's not what it should be called. And there are medicine out there compatible with pregnancy, compatible with breastfeeding, that can do a good job to reestablish that balance while our body will get back to itself. And the postpartum times, they used to say 6 weeks, but nowadays I saw, and I'm glad that they expanded it to 12 weeks. So until 12 weeks, we should expect all the hormonal changes that occur during pregnancy can still be a cause of mental disruption and every type of other medical issue that a postpartum woman can develop.
Yeah,
Okay.
and doctor, I waited 7 months until I took my medication. And I told myself, I'm gonna be fine. You can do this. But it's like hurting your knee. When your knee, if you break your knee and you don't take painkillers, you're not gonna be able to walk. And if people keep telling you, but just walk right, you need to walk right, stand up straight, walk right. Well,
Yes.
you can't because it hurts and it's broken. In the same way, when our brain is not working well, we cannot just calm down. We cannot
Exactly. And
stop.
I'm glad that you finally understood that and you took the right decision, because now look at it's gone, it's over.
Yes.
And that's the beauty of it. It's over, it's not forever. And I want to reassure everyone listening, even the postpartum psychosis as
Mm.
a treatment, it will be over.
Yes.
Okay?
Well.
And we just have to be patient and we just have to look for the right help, okay, at the right time. And don't be ashamed of talking about it. And when I had my patient, whenever they come back after 6 weeks and they will tell me, I'm crying nonstop, I
Mhm.
feel tired. I don't even have the patience to be with the baby. I don't know what's going on. I would say that's normal. And
Yeah.
they will be all surprised. I said, this is normal. And I said, sometimes what I would say to people to acknowledge that you're not feeling well, go in front of a mirror, cry, look at your face. And until you realize, okay, this is me, I'm not feeling well, and it's allowed. It is allowed. Okay?
Yeah.
Everybody has their up and down in life in general, right? But this time is a particular time. Your body went through a lot of changes. It's a big event that happened.
Yeah.
And that event took 9 months of your life, of your body. Okay? So it's not a joke, it's a big deal. So I'm glad that you share with us that experience, because no one else can really describe than a mother who went through this. And I think we all went through this. Okay? And to tell you my own story also, I went to that period of time.
Yeah.
And I was at least educated enough to not refuse the right help. You
Mm.
should find the right help. And
Yeah.
if the OBGYN keep telling you, oh, that's nothing, that's nothing, that's nothing, but if it lasts more than 4 weeks, you should insist and
Yes.
look for the right help.
Right.
Because, okay, it can go wrong also, okay? Not
Yeah.
every story is beautiful like Sophia, like Sarah, like mine. Okay, I've seen people going the other way.
Mm.
I've seen people going to the psychosis and not looking for the right help, going to other, I would say, direction in their
Mm.
life. And
Yeah. Tragic.
they can
Yeah.
never pick up back themselves because
Mm.
they didn't have the right support at the time.
Right.
Okay,
Yes,
it's
ma'am.
very important. I'm glad that decide to take that topic today.
Yes,
Thank you.
speaking of support, we have a question for you, Sophia. And again, thank you for sharing on such a difficult topic. You putting yourself out there so other women can find help and say, hey, if she had gone through it, she's out. Look at her, she's beautiful. Her baby's doing well. You know,
Yes,
she's doing well. And so thank you for doing that. You have a
yes, thank
question.
you.
What support system did you have? Dr. Burrell mentioned that it is important for the men, also the fathers, to be involved in
Yes.
that process of recovering your health totally. What type of support system did you have to help you overcome postpartum depression?
Wow. Well, first off, I was blessed enough to have definitely stay with me for 4 months. That was a big help, but she had never seen me go through an emotional breakdown. So having her was a blessing to help me with the baby. But
I'm
emotionally,
sorry. I'm
go
sorry.
ahead.
I think we got cut off. Who was that helped you?
Oh, my mom.
Your mom. Okay.
Yes,
Yes.
yes, my mom. She helped me a lot with my baby. But when it came to my emotional instability, she didn't know what to do. She was as scared as I was. So I think definitely informing them, giving them the information helped me. So they became my support system as they learned with me. So I think that the best way, honestly, is for people to know about this before, for husbands to accept that it might happen and it's okay if it happens. Something that, well, my husband would tell me is, baby, it's okay. It's not going to happen to you because I was with a program and they told me, Sophie, if you had depression in the past, it's very likely or possible that you are going to deal with postpartum depression. I immediately said, no, 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 it's not going to happen to me. Not again. Well, it happened. And if my husband and I would have been ready, I think we would have had the tools fast. But he was a great tool. He kept reading and reading and learning. And something that helped a lot for us is the moment that he said, she is going through this. She can't help it right now. She said this awful word. She can't help it right now. It's okay. There was a point where I was so angry that I even told my husband, I need you to leave this house, leave. And my poor husband was so heartbroken. But in his mind, he had to repeat, his mind over and over. This is not Sophie speaking. It's depression speaking. After that, I started taking my medication and my life changed. So having him over and over remember that his wife is not that person, that is just this well, me, his wife, going through a stage, going through a little process that is going to take a while, but she doesn't really mean to hurt you. She doesn't really mean to say awful words. She doesn't really mean to go to sleep and leave you with the baby alone. It's depression takes over for a little bit until we find the right help. So be prepared. Be prepared and inform your spouse about it. Inform your husband. Let him have the tools. Um, and definitely help your wife with the baby. So yeah, I think I've had many people talk to me about them not wanting to open up to their family because they were ashamed. So I would definitely say pick in your family who you're gonna share. Your husband, you should share. Your husband needs to know, and your husband is gonna be your major support system if he knows. But if he thinks he's right, if he thinks it's you who's acting out, then you both need to find some professional help and inform yourselves because that's definitely ultimately going to bring the healing. My husband and I went through a lot of ups and downs, and right now we're still fixing our marriage because I said a lot of offensive words in the process. But it's again this mindset of it's depression talking. Depression is talking right now, and it's not gonna be like this forever. Even right now, my medication might be taken off. So that's how good it gets later on.
So, Dr. Burrell, would you say that it is important during those visits, once these women get referred to the proper to the appropriate professional to that talks to them about the depression and being medicated, should the husbands also go to those appointments with the woman?
Definitely, I will say yes because it's not just a matter of giving medicine. I think what we call psychotherapy, the talk therapy, is very important. And sometimes we even refer them to a group therapy just because it's very helpful to know that you're not alone.
Yeah.
And I do believe that it's a must for the husband to be part of this. And it's not just about postpartum depression and postpartum blues that we should have that backup. I think I really, as an OBGYN, I really appreciate and I almost always, I would say always, I commend and I compliment any couple who come together to
Yeah.
me because I think I have no way to describe it. The symbiosis, the bond between a woman and her husband is essential to everything. When I say everything, I'm talking about everything you're doing, your medical health, your success in life, even in your profession, everything you're doing. Try to involve your partner, your husband with you. Okay, so if you go to the therapist, that person who is sleeping back to you, who is there for you,
Yeah.
who has your interest, right, should be there. Should be there. Okay, because that person should be involved in what the therapist is going to suggest to you. Because I'm sure the therapist will give you some little homework to do,
Mm-hmm.
right? And the therapist is going to encourage you also to do those steps together with your partner, with your husband. And I think it's very important. I can't emphasize enough how important it is to not be alone during that time. Don't stay alone. Okay?
Now, Sophia, you mentioned in the beginning that it was a little bit, you were a little bit, you were resisting the idea of being on medication, perhaps because of your background, your ethnic background,
Mm-hmm.
perhaps because of perhaps because of your faith, because being in the faith community, a lot of people think that, you know what, we gotta cast this thing out and we're not gonna be on medication. So, being that you were a little bit resistant about it at first, what pushed you to accept it?
It was definitely, well, first off, my therapist. My therapist had the same belief system as I did. Well, as I do. And having her comment and mention to me how God's healing comes in every way and form, I already knew that. I was a youth pastor by then. I already knew that. But having her remind me how there's nothing to be ashamed of, um, having her remind me that God heals in different ways, having her remind me that this was not going to hurt me. I was really scared because I thought I was going to be drowsy, I was going to get addicted, that I was just going to become kind of like a living zombie, because those are the stories that people share for some reason. Um, and then she told me, no, you're just gonna look at yourself in the mirror and be like, oh my gosh, I'm back. And I couldn't believe it. And when I did, uh, I was so surprised. After a week, I told my husband, I just told him, I'm back. I'm officially back. And so yeah, like it took a lot, even not, I wouldn't say convincing, but a lot of educating to my family, because they're still in Ecuador, we're Hispanic, so it took some educating to do, because maybe you just need a little more of the Holy Spirit. Maybe you're just lacking some self-control from the Holy Spirit. I was told that, actually, that I lacked some fruits of the Spirit, including self-control.
So,
Sorry, go ahead.
so in other words, they were not taking the physical part, like Dr. Burrell explained earlier, that there was a huge increase in the hormones, mostly female hormone during the pregnancy, and then a huge drop, a huge decrease. They were not taking into consideration that physical aspect or
Yeah,
biological aspect, but they were
exactly.
considering just the spiritual part.
Exactly. So that was mostly like the church, Christian friends. I would say my family was definitely more a cultural thing. I think my father dealt with it in the past. So in my family, there was a lot of resistance to medication and the fact that you don't need it. You can be a happy person without it, without it. So when my mom finally saw me again and saw how happy I was, how I could manage my emotions. Not only that, but I could acknowledge my emotions and be like, I know I am sad. It's okay to be sad, but I don't need to shut the door and scream. But I can still be angry, and that's okay. So it took some education to do, definitely. And even myself, to know that this had nothing to do right now with only the spiritual realm, but it had to do a lot with physical. And when I was explained that it has to do with my neurotransmitters and how, like, they were like, imagine some cables are just like not working that well. You need to mend them, and it's okay. And so then I was like, okay, let's do it. And when they told me that it supported breastfeeding, I was like, I'm all in. I'm all in. As long as I can still breastfeed my son, because that was one major expectation that I wanted. I wanted so bad to accomplish. So they told me, you can breastfeed. I said, I am in, and I'm ready to be able to hold my crying child and not get mad at him. And
And
it happened.
And that's what I was going to ask you, Dr. Baril. And Sophia, you saying that it was very important for you to breastfeed your child, and I can perfectly understand that. So much so from a cultural standpoint, being from Haiti, we have women, who give their babies, who breastfeed their babies until they're 3, 4 years old, right?
Yes, same.
Yes, they do, right? So much so from a cultural standpoint that it's
Yeah.
important to breastfeed. Now, would not the medication affect breastfeeding, Dr. Burrell?
Um, I am sure that the category that they use for her is what we call the SSRI. So what they are exactly is the selective serotonin receptor inhibitor, and some of them are very, I would say, safe.
Yeah.
And in terms of breastfeeding and pregnancy, we have category. Even though they are most of them, all of them are category C, but still we consider them as safe. And again, I want to tell everyone when it's time to make a decision about taking a medicine, there is always side effects, right? Every medicine, even aspirin has side effects. Tylenol, acetaminophen has side effects. Water can cause complication, right? Too much water. But you have to weigh the benefits and the risk. Okay, what are you trying to get from there? And she made the right choice because she would have get better, but that would have taken longer for her to get better. And
Mhm.
during that time, I want to remind you, it's essential that she try to reestablish herself, her health, in order to start bonding with her baby.
Mm-hmm.
So this is important. This is a very important point because
Yeah.
imagine if you're not even paying attention to your baby anymore because you're not yourself. So that baby is missing the most important time of his life.
Mm-hmm.
Baby doesn't have a mommy to get closer to be involved emotionally. I know you may not understand the baby as emotion at that time, but I think this is a very important period of their
Yes.
life. Okay, the newborn, they know, they understand. They have a feeling, they have a sense of what's going on. Okay? And the second thing, she could have put too much pressure on her family, her husband. So she did the right thing. She did it for herself, she did
Yes.
it for her son, and she did it for her husband also, for her family, to
Exactly.
protect the family. And I think that's the right thing to do. Because the husband may be very tolerant, very patient, very nice I would say you were very blessed to have somebody very supportive. But not every husband will go through this
Yep.
roller coaster and accept like this. So it's a big risk. And that's what is unfair for women sometimes. Sometimes they have to lose a lot. They are giving birth to create a new family, to build a family, and they are the one losing out of it,
Yeah.
right? She could have lost her marriage. She could have lost her family, lost her family. You understand? It is sad. And a lot of people, because they don't seek for that help, they
Yeah,
end
I
up
was so close of losing my marriage. I was this close
exactly. They end up
to losing
losing
my
everything
marriage.
because this is the time where your body is no longer the same. You're not
Exactly.
active anymore. You're moody. Okay, and you, as I said, you're no longer attractive for that time
Mhm.
just after delivery, right? And on top of it, now you feel sad, you feel depressed, you feel
Mm.
that you're not yourself. Oh my God, it can be terrible. I'm telling you, this can be terrible. Okay?
Absolutely. Now, Sophia, what was it like after perhaps maybe a week or so taking the medication and finding that balance, finding that you are actually looking in the mirror and rediscovering yourself? You're like, wow, okay, I'm clear-headed. I'm not confused. I'm not overwhelmed. What was it like for you? And how has this taken you back? Because when you unbalance like that, you
Mhm.
can pray, you can concentrate to
No.
pray, to fast, or to do anything. You can even brush your teeth or take care of your
No,
own self, of your hair, or whatever. This is
I know.
depression. And you have a little person tagged, stuck on you, and who needs your care and your
Yeah.
attention. Now, what was it like when you were like, okay, now this thing called medication is balancing me back and I can actually feel there is hope? What was it like for you and for your husband?
Yes, it was. I was so surprised. Honestly, even the first day I took it, I I was like, I just felt a little weird. I was like, maybe I just need to take a nap. But exactly 4 days, it took 4 days. At the fifth day, I was feeling so different. And like I even mentioned when we were talking before, when I was able to hold my crying child, because my baby, even up to now, sometimes he doesn't like to go to sleep, but I was holding my crying child, and before I would just start shaking, and then I looked at him, he was crying, and I was like, I don't care. I was so surprised. I said, I don't care that he's crying. And not in the fact that I was careless, but it didn't make me angry. And I just looked and I was like, this is so weird. And I even tried, even my brain started playing tricks with me. And like, is it psychological? Like, just because I know I took the medicine, I'm like, not like this. It was just weird. And I was like, oh my goodness. And then I went to my husband. Our relationship was a little broken by then. But I went to my husband and I looked at him and I told him, I'm back. He was like, what do you mean? I said, I'm back. He's like, what do you mean? I am back. It's me. I feel,
Back, baby. I'm back, baby.
yes, exactly. And I told him, like, I can see, like, before I didn't even care. I didn't even care about things, details, or sometimes I would care too much about details. I got a little obsessive with routines, with my baby's routines, which I think are important. But again, if I want to be relaxed, I could. My husband, he was like 30 minutes late to give him his dinner, and I said that's okay. Before I would have freaked out and told him, no, this is when you feed the baby, and the baby needs to eat because feeding and because blah 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 blah.
Right.
And I told him, and I was like, I don't care. It's just 30 minutes. The baby's fine. He's still gonna stop leaving just because he's 30 minutes late. And
Right.
little by little, as I kept going to therapy, I got so much better.
So how has it helped you regain your composure spiritually?
Yes, it has been a journey. I can honestly say that even up to now, I'm still working on it because before there was nothing. I mean, I would honestly cry to God almost every single day and ask Him, why have you forsaken me? Why did you leave me? Why did you do this to me? And I remember, like, I kind of felt Him saying, like, I didn't do this to you. But you have to remember that the sun shines over good and bad people. The sun comes out for everybody. Life happens. And I was like, that's right. And now that I was able to understand, I was able to see that God was there the whole time. He was not causing me the depression. Instead, He was leading me so many times to the right way. And I kept ignoring it. I said, no, I don't want this. And I kept saying, no, this is not what I want. No, I'm just going to take vitamins. And then when I finally accepted, I realized how He's been there the whole time and how God in my life didn't become a God of every day. Just if I and this is an example and this is personal, but sometimes I wouldn't even have time to read a verse and I would feel so guilty. But now that guilt has kind of lifted off, and understanding that I can worship God in every way as long as I keep constantly acknowledging and understanding that He is God and that He is here and that He loves me and that He will love everybody in spite of anything. So now I kind of getting myself engaged in conversations, in groups. Actually, today I had a group with some ladies where we're having a little devotional on the armor of God. So just trying to get myself involved and having accountability, because something that I still struggle with is forgetting things. I forget many things, or sometimes I'm a bit too distracted. But keeping myself accountable with other friends that are there to listen instead of suggesting, and that is a
Right.
major help. So it has definitely been being able to pray again, being able to say, God, I love you, instead of God, you ruined my life, because that's what I would say. And it breaks my heart, because as a mom, if my son tells me that, my goodness, the pain. But now I'm so surprised how I can say, God, you've been here the whole time. How could I not see it?
Because
You
now
know?
you're clear headed. Now your head is
Exactly.
not cluttered, that it's clear. Your
And now
brain.
I come to Him when I go back to these emotions, because sometimes, anxiety can take a little control sometimes, and that's okay. But I can come and be like, God, I know you love me, and I know this is part of what I've dealt with. This is part of what I'm dealing with. But help me understand that you love me in spite of this. And I am beautiful and I am wonderfully made. I'm a great mom. I am a great wife. And tomorrow I
Yes,
will do
you
even better.
are. Yes, you
Right?
are. Kudos to
Amen.
you. We applaud
Amen.
you. Yes, you are.
Amen. Thank you for that. And it just feels, I feel so happy, to be in this place. But I still think
Wonderful.
the women that were there, are where I was before, when I couldn't see the light, and give them hope. There is a light. It does happen, and it's okay to wait in the process. It's okay to stay in the process. You know, but it's possible.
That's what you said is so true. Sometimes we want to avoid the process. We want to
Yes.
avoid it. I think Dr. Burrell wanted to say something, but
Oh,
yes, we're gonna ask you to talk because you said you were gonna talk. You talked about a group and you're staying accountable. We're gonna ask you to talk about what you are currently doing in terms of impacting others instead of in terms of helping others when we come back to you. Dr. Burrell, go ahead, please.
okay. So I'm glad that Sophia is describing everything with so much ease. I think we could not have find a better guest today for this
Thank
topic.
you.
She said something earlier about not having even the knowledge that God was there in her life and could help her. And I want to just go back to what we call, because postpartum depression is a mental illness. It's a disease, okay?
Yeah.
Um, and many of us, we go sometime to our up and down in life. And as you just said, having to go to depression or anxiety disorders, I would say that sometimes we are not connected to the real our reality. Okay, we don't even remember who we are. We cannot associate things anymore. It can be as bad. We cannot even assess things the right way anymore. It means that our judgment is completely upside down. We are no longer the same person. And I want people to remember that. Don't think it's forever. And I like to, for example, now I'm dealing with family members who are going to dementia, Alzheimer, pre-dementia, pre-Alzheimer. And it's almost the same thing. I know maybe this situation has no reverse. It's not reversible, right? However, I can tell you the way I compare it and I make people understand. Some days it's like a connection. You see, when you put the plug, sometimes there is good connection, everything pass well. Sometimes it's no longer connected, it's disconnected. And when this cord is not well connected to the outlet, guess what? Nothing passes. So that's what happens in our brain when we are upside down, when we are off balance.
Yeah.
Okay? I don't want people to get offended sometimes when, for example, your husband was very tolerant. He accepted all the bad words, the bad things that you said. Okay? I'm inviting everyone listening to us. Do not make fun of people going through a bad time in their mental illness situation. That person is no longer the same. That person doesn't even understand what is out there around him or her. Okay? And is disconnected or she is disconnected. So we need a lot of love and patience. And again, I said, it's a biological thing, it's a chemical thing.
Yeah.
And by the way, I forgot to say, sometime when you go back in your 6 weeks postpartum, we may need to do a thyroid test. I will not be surprised that a lot of people who are prone to develop depression, anxiety, they sometimes have underlying problem with their thyroid glands.
Mm.
Release enough thyroid hormones. And other biological problems can be the underlying cause of this mental illness. But Sarah, you said it. In our country, we are from Haiti and she's from Ecuador. I think we have the same stigma for mental illness. We always think there is something supernatural that come up top of us. We never think it's something that can happen to us.
Mm-hmm.
Our
Of
children,
course,
family
of
members.
course. And we're not dismissing divine power, the power of prayer or our faith, but we do also understand
Mm-hmm.
that biologically, psychologically, things can get a little bit haywire.
Exactly.
I can, and it's true, people. It happens. It happened with me. On my third one night, my sister Geralda came over, and I busted out crying, boo-boo crying, and she was like, "What's wrong?" And then the next day, she stopped by. She wrote me a beautiful letter. I'll never forget that. She understood that something
Mm.
was wrong, but I didn't know what was wrong. I just didn't know what was wrong. And also, I'm going to take this to another angle. Sophia, don't forget, you're going to be talking to us about your platform and what you're doing currently. But I do want to take it to another level. It is not just about women who have had live births. As I was doing my research, the 900,000 annually are affected by postpartum depression. That number includes women who have had stillbirth as well as live births.
Mhm.
So a lot of people do not know this, but at one point I have three children, but I was pregnant between the second one and the third one, and my last one is actually my fourth. It was
Wow.
early in the pregnancy, but mind you, I had my other two children. They were about maybe 10 and 8 at the time, 10 and 8. And then I got pregnant early stage of the pregnancy, and I lost the baby. I have
Mm.
two children, and I started bleeding. I lost the baby.
Mm.
Okay. They were doing the procedure. The day they did the procedure, I went in. Okay. They had to do this, they had to do that. Fine. Okay. Medical procedure. They had to clean the DNC. They had to do the DNC, I believe it's called, Dr. Burrell.
Yes.
Mm.
As I'm walking, no, 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 no. I take that back. It was after I bled, I went to the hospital to check, and they were doing the sonogram, and the lady tried, and the lady tried, and she was passing that thing on my belly, and she tried, and she tried, and she tried, and she tried, and she's like, no. She said, there is no heartbeat, there is nothing, there
Mm.
is nothing. You need to make an appointment to come back, and then we're gonna do this, 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 and that. I have two children. I walked out of there like a zombie. I walked out of there like a gaga. I was numb. I was empty. I felt hopeless. And I felt something just came over. And I'm like, I said, I already have two children, but just it's us women. We are built that way. I mean, it's like when you lose something. So that's why I wanted to take it to that other angle. It's not just about giving live births and going through the postpartum depression. It's
Mhm.
about our friends and our
Yeah.
sisters, our family members who have gone through the awful experience of losing a baby during pregnancy or pushing a stillbirth baby. That's even worse. Not only you grieving the loss, and now the hormones are going back. It's enough to make let pass in a tattoo. It's enough to make you go crazy, cuckoo. And this is physical, and this is normal. It is the normal course of things that happen in the body.
Mm.
Do you get me? So what would you say to someone, to the women? I know you minister to those who have had live births, but what would you say to someone who've had a stillbirth baby or who have lost a baby
Miscarriage.
during pregnancy? I mean, how do you minister to these women? I know this is a deep, very profound question that I'm throwing out
So is
you,
that
but
for Sophia or for me?
well, to both of you. I know Sophia ministers, but Dr. Burrell, you can start if you'd
Yeah.
like. And Sophia,
I'm glad
we're
that you
gonna
bring that.
finish with you. We're gonna close with you. You're gonna tell us how you minister to these women and as well as your platform, what you're doing currently. Go ahead, Dr. Burrell,
Yes.
please.
Um, for the same reason that we explained that the body is going through a lot of changes during pregnancy. So even that woman who end up enduring a miscarriage or who end up having a stillbirth, her body went through the same type of changes.
Yeah.
And mentally, it's like I would say like a failure when you cannot
Mm.
conduct pregnancy at the right term. Okay, it's very painful, and I'm glad that Sarah opened this topic also because sometimes we underestimate people who end up having miscarriage or people who had spontaneous miscarriage and people who had stillbirth. And also another thing, people who has children with birth defect, it's another thing
Mm.
very hard, it's even harder. Okay, so I think those women they need as much as attention as the one who delivered a live baby, a live infant. Okay, they even need maybe more support because nobody paid attention to them. Sometimes we forgot about them. Okay, it's very important that we, as a OBGYN, as a physician, that we pay attention to this aspect also. It's not just looking at if everything is back to normal, if she's no longer bleeding, if she's stable. Okay, no, it's not that only. It's to make sure that patient is back to herself,
Mhm.
mentally, emotionally. Okay, and as I said, we don't rely just 100% on the questionnaire because some people can lie when answering that questionnaire. A lot of patients, they don't put the right answer. I think we should be, that's why it's important again to be very connected to your caregiver, to the provider who is in charge of your pregnancy. You should be you should be close to that person so you can rely on that person. You can relate to that person and talk to that person with an open heart. Don't hide anything. Okay, talk. That's what I would say. Okay, that's the best advice I could say I can give. Okay, to be close to someone, as you said, if it cannot be your doctor, it can be somebody else that you can really trust and somebody that you know is not going to make fun of you. Because I know people say, "Oh, you that baby wasn't even 3 months. Why are you crying?" They won't understand that. Okay, they will not understand that. But it's a loss and it's painful. And sometimes we don't know how to get back to ourselves. Okay, and I think it's very important that you brought this aspect of the topic. Also, it's not just live birth; it can be for any type of birth. Okay, and I know that they call it postpartum, but this is a broad name. Partum means delivery, but it can be miscarriage also, post miscarriage depression. Understand post miscarriage blues? It can happen. Okay. For the same reason, we have those hormones going back. We have a lot of biological neurotransmitters that are not at the right place. We are off balance, and we should expect the same type of issues.
And I'm so glad that that we have a doctor. My goodness, I think it's wonderful that we hear from a doctor because sometimes we don't like to believe if it comes from other people. So I'm so glad that Dr. Burl, you can share that because I say things from my experience and because I am a very empathetic person. But I'm so glad that you are mentioning these things because as even as a person that has gone through postpartum depression, I was so scared of opening up to my doctor because I thought they were gonna send me to the hospital and lock me up for being a little crazy. And I was scared. I was so scared. I thought I couldn't trust anybody until I was able to open up to my doctor and they told me it's okay. You are not the only woman and I totally understand you and these thoughts that you're having, they're okay. They're normal. You're not weird. I felt amazing. I felt supported. I felt beautiful.
Mhm.
And I think that is so beautiful to hear, doctor. Thank you for that.
Yes, but Sarah, I don't know if you're there, if you
Yeah,
will allow me to say something.
sure. Go
Because I
ahead.
know we have people watching us, and we will have more people maybe to see that um, talk show again. I would like to say, Sophia, you and I, maybe we had been lucky to have the mild form of
Yeah,
postpartum depression. Okay, but I've seen worse during my time as an OBGYN.
of course.
The last level of, I said, the most severe one called psychosis. Those people, they become delusional. They hear voices.
Yeah,
Okay, and I'm talking about psychosis. I'm becoming crazy, and that can happen. And I want to remind everyone, remember that that can be reversible. Do not give up.
yeah,
Okay, even you think you're going crazy, you hear a voice, you see things, you're delusional, you're no longer able to have a good judgment, you're no longer going to be able to maybe to know what is around you, you are disconnected. It can be that worse, can be that bad, but guess what, there is hope.
there
There
is.
are medication, and among the medication that we are talking about, we have the group of antidepressants just for a small little depression. We have mood stabilizer, and we have antipsychotic medication.
Mm,
So you have to trust the professional. I'm not a psychiatric doctor, but
mm,
our job as OBGYN is to route you to say, okay, this is what you need now. At that point, you need this, and you should be willing to listen. But I know this is the time where maybe that person is no longer somebody that they can make have a real reason process anymore. So that's why it's important for family member listening to us. If this happened in your household, somebody who just delivered cannot make sense to you anymore.
Mhm.
That person is talking nonsense. That person is telling you, I'm seeing a big cat passing there, or I'm listening, somebody's telling me to kill myself, or somebody's telling me to hurt my baby. That's true, that can happen. This is called postpartum
Mhm.
psychosis. Okay? You need to take the responsibility now to bring that patient to the right provider. There is help out there. It's not going to stay forever. It will go away, but with the help of the right person, the right medication, right person. And
Yes.
don't be scared to take medication. Please take the medication appropriate for whatever is your case. Okay?
Yes, thank you so very much, Dr. Burrell, for coming on. We just did not want to bring Sophia on, but we wanted to bring professional like you who's saying, I don't know, in 15 years of practice, 15 plus years of
Wow.
practice, well, solo practice, you have more experience. You've seen scores of women and you have referred them and channeled them to the right help when you do detect postpartum depression. Thank you so much for that. Thank you for coming for the second time to the
My
platform.
pleasure.
Okay, we'll have you back. Sure thing.
I
And I
should
will,
thank you, Sarah. I should thank you, for everyone listening, okay, because you're bringing awareness in our community, and it's very important what you're doing. You're doing a great job. I'm so proud of you. And thank you also to Sophia to share with us, because it takes a mother to come and tell those symptoms,
Thank you.
the challenge of going through this time, difficult
yes,
time.
thank you, Dr. Burrell. Again, it's not that we're dismissing divine power or the or prayer and fasting,
Mhm.
no, but also we also know that, like Sophia said in the beginning, that God is omniscient. He has all science, and He does have ways for His children to find healing. So Sophia, so again, Dr. Beryl, thank you so much. I'm gonna bring Sophia on so she can give the last thoughts, the last word. Please, Sophia, tell us what is your platform about? How are you currently helping women? And don't, yes, go ahead and do.
Mhm. Awesome. Thank you so much, Sarah, and thank you so much, Dr. Baril. I feel so blessed to be here because I feel it's also a confirmation of what I believe in, a confirmation of what I've been feeling, a confirmation of what I should do. And recently I decided, and again, I think Pastor Sarah told me, don't minimize it, don't make it little, but I thought it was little. But I have started a movement called Mommy Can and Mommy Will. Because when you're going through postpartum, the first thoughts that come to your mind are mommy can't and mommy won't. So those are the thoughts I was living in for the longest. And not only that, but I struggled to find people that would listen to me and not judge me, or that I could talk to and they wouldn't give me suggestions. Trust me, there will always be people giving you suggestions, and I know it's hard and I know it's complicated. So that's why I created Mommy Can and Mommy Will. Um, and you can find it through my platforms, especially Instagram at Sofi Mino. And that's where I'm starting to share little by little details of my journey with depression. And it's been a blessing to hear of women that are out of the country, different countries, that have gone through it and that ask me questions like, how did you know you had it? What did you do? How did you manage your medication? Who did you go to? And I feel so blessed to be able to help other people break break this, I don't know if, well, break kind of this taboo, right? Break this condition that has been minimized. Many times I was told, it's just, you just have to mature, you're just not mature enough. At 27 years old, you need to mature more, which I do. But it had nothing to do with maturity. It had something to do with um, hormonal imbalance. And also possibly something that was inherited to me. You never know. But I definitely want to motivate other women. And I found so much healing in helping others. If you deal with depression and anxiety, something that happens is you feel you have a huge bubble around you and no one can help you and you can't help yourself. So by reaching out to others, by helping others, by being involved with others, you kind of burst that bubble and start opening up about emotions that you know you had but you couldn't break free from. So when I started Mommy Can and Mommy Will, I was able to burst this bubble and start sharing to the world that it's okay to have depression, it's okay to have anxiety. You're no less human for having these conditions, but instead that you're beautiful and that you can succeed. You can succeed in spite of your difficulties, in spite of your disorders, in spite of your physical disabilities. So that's why I started Mommy Can and Mommy Will, and start ministering other women that go through any kind of depression, through anxieties, through physical disabilities, to motivate them to succeed. And succeed doesn't always mean have money, doesn't always mean be the best. What it means is to be able to do life and be happy as you do it, to be able to see God in everything you do. So I definitely motivate women to join me in this journey too. Also, Pastor Sarah, I invite you to keep these conversations up, to communicate with other women, to keep helping so many people that don't want to open up because they're just scared of being judged. But guess what? We don't judge you. We love you, and God loves you, and He supports you. So educate yourself, definitely motivate each other, and remember, always remember, not only Mommy Can, Mommy Will, any person can and any person will. A woman can and a woman will. So yes.
Absolutely. Thank you so much. And I believe that our viewers really enjoyed this moment. I will ask you to share. I thank you for being on Facebook. All of you on Facebook, please share this broadcast. It's very important information that came forth from a medical doctor, Dr. Joanne Compass Burrell, and from someone who actually went through the experience of being of having postpartum depression. We have someone who's in her 6-week postpartum, and she's saying great information. I'm 6 weeks postpartum, and I've been through a lot. So I'm sure that she has learned quite a lot from both Sophia and Dr. Burrell, and she's glad to be here. Also, one comment is when visiting a friend who has just lost a baby, one should avoid visiting with their own children and also a group of friends and discussing their children in front of that person they're visiting who is obviously depressed and do not have their child with them. So things like that we should always consider when dealing with women who've lost a baby or is going through a hard time after giving birth. Well, ladies and gentlemen, I do thank you for being here on this platform. Those of you on Facebook, share. Those of you on YouTube, please, you can like it right now. Go ahead and like if you like it. You can like it. And you can comment, you can share, as well as subscribe to Sarah Batroni channel. I want to remind you, on Sunday afternoon at 4 p.m., I will be bringing on this platform Pastor Dana Coverstone. Pastor Dana has been having a series of dreams for America. For such a time as this, the Lord is communicating to him. He's been having those dreams since December of 2019, way before COVID happened. 19 happened. He saw it. He saw the violence. He saw things, and we had him here in July, so we're gonna bring him here again this coming Sunday at 4. Hey, word of mouth, spread it. We're gonna drop the trailer tomorrow. Please be with us on Sunday afternoon at 4 p.m. You'll have Pastor Dana Coverstone. Again, ladies, I do thank you from the bottom of my heart, and our viewers also thank you.
Thank you.
Thank you. Thank you.
Good night. Yes. So this is it until we meet again next Thursday for another great Thursday Night Live. Our guests, Sophia Mino, and Dr. Joanne Burrell. Thank you so much for being here, and good night. May the Lord bless you and keep you. May the Lord make his face shine upon you. May he be gracious unto you. May the Lord turn his face towards you, and may he give you peace. In Jesus' name, God bless you. Good night. I'll see you tomorrow morning for our prayer. God bless you. Good night.